stand here, so my sweet spot is hand talker. I'm gonna, so I gotta remember.
I don't think as we just sit here. Well, you think this year.
This is awesome. Got a full house. And we got people joining us online as well. So everyone, Nima, hi. It's nice to see some of our graduates coming back for today. Yeah, so welcome. Today we got a really cool guest speaker talk. I mean, Jonothon and CanPrev have been partners and friends of IHN for so long. I know I've known you for at least 6 years already, and excited to always have you here. And today we're going to learn a little bit about understanding the life cycle of nutraceuticals. So for those of you that don't know Jonothon, he's a naturopathic doctor with an extensive naturopathic background, as well as a background in business and economics and health sciences. He currently holds the vice president medical director position at CanPrev, and has over a decade of product formulation, business development, and education experience in the natural health industry. So as a product formulator who travels globally to source and critically evaluate ingredients, he's here to help us gain a deeper understanding of how certain ingredients are selected, why others are not, and share some valuable insights into what goes into creating a nutraceutical product. So Jonothon, I'll give it over to you.
All right, thanks, Jason.
Yeah.
I just want to honestly thank you guys for giving us your time. And everyone's time is extremely valuable. So we really do appreciate any time that you guys choose to give us your time. We are going to reward you for giving us your time. So I don't know if you got a sneak peek into the next room. There's a whole bunch of samples. So we'll walk you guys through the samples afterwards. So in terms of today's presentation, really it's just sort of understanding sort of what goes into the product development cycle. And I like this presentation from the perspective of, I think if you've gone through any sort of school or education sort of in this field, you've always had in the back of your mind that maybe you want to be involved in product development. And this is just sort of an insight into that process in terms of some of the mechanics that we have to think about when we go through this process. And as Jason mentioned, I mean, part of my job I think that's on the next slide, but part of my job is essentially product development, product formulation. I like to call my job everything but the label and bottle when it comes to the product. Essentially what that means is everything inside of that product, that is my job to figure out. So I help source the raw materials, do the formulations, I do the regulatory affairs with Health Canada, I'm in charge of quality control and quality assurance the company. So it's my job to be able to deliver a quality product that happens inside of that product. We also have some special guests who just showed up from CanPrev as well. I wasn't 100% sure that they make it. That's Norman on the far left. He's our VP of marketing. So all of our labels, that's actually his part of the job and his responsibilities. Beside him is Dr. Frank Silva. He's the medical director for CanPrev. And Lotus, I don't know your exact title, but manages all of our social media, I believe.
Brand stuff.
Let's call it brand stuff. Perfect. So they're in attendance though. So thank you guys for showing up. All right. So in terms of the product development process, I'm really going to break it down to 4 simple parts. There's a lot more parts to this. For the purpose of this presentation, we'll break it down into 4 very simple parts. The first part is sort of deciding on the product that you want to make. And I say when you're making a product, there's really 2 types of products that you can make. You can make a product that's ingredient focused. So essentially what I mean by that is you have a really cool ingredient that you want to develop a formula either by itself or be the basis of a combination of a product. Or second is you have a focus for that product. You want to make a product for blood pressure, for heart health, for adrenal health. So there isn't necessarily an ingredient that you're building a product around. You're building it for a specific application or a very specific purpose. And it's important to identify this first because based on the idea of what we want to create, then we need to figure out how we want to deliver this product because there's so many ways we can deliver nutraceuticals, capsules, tablets, soft gels, effervescents, gummies, stick packs, liquids. There's a variety of different ways and not every delivery format is going to be able to be made in each of these. Every single product is not going to be able to be delivered in these formats. So it's important to understand our product first. Number 3 is Health Canada licensing. So if you're going to sell a product here in the Canadian marketplace, you have to obtain something called an NPN or a natural product number. You always have to be thinking about this in the back of your mind, because if you design the coolest product in the entire world, but you have zero chances of getting an NPN, you wasted all your time. You always have to have the regulatory component in the back of your mind. And number 4 is finished product testing. So here in Canada, we have a whole bunch of finished product tests that we're required to have to do as per the NHPD or Health Canada. And depending on the type of formulations or ingredients that we pick, this can also dictate the different types of tests that we have to do. We also keep this in the back of our mind, because some of these tests are really expensive, some of these tests are not. So sometimes we think about ingredients depending on what type of tests are required as a function of what we choose to put into a formulation. All right, so starting at the beginning, and I'd like to show this. This is something called an ingredient C of A. We also refer to this as the product data sheet. It's also known as a technical data sheet. And every time we're selecting raw materials, we're always looking for this, because it provides us valuable pieces of information. So there's a few things that we're looking on. This is a magnesium bisglycinate C of A, or a technical data sheet. There's a few things that I'm looking for on this. One, I want to know what amount or percent of this material is elemental magnesium. And I say this because when you put a mineral in any product here in Canada, you're required to list the elemental amount of that mineral, not the total material, the elemental amount of mag, the elemental amount of zinc. And this percent just tells us how much of that material is elementally that mineral. So it helps us with our formulation in terms of how much material we're going to need to deliver certain doses of stuff. There's another number on here called density. And one thing I will say as well is, if you don't like math, don't ever do product development. You have to love math. If you don't like math, this is not your job. It's not your job. You will not enjoy this job. What this density number does is it gives us an idea of how much of that material can fit in a capsule. Standardly, we use something called the 000 capsule here in most products. And there's this misconception in our industry that every capsule can hold 1,000 milligrams of material. That's wrong. You can only fit as much material in that capsule as the capsule will fit. It differs based on material densities, and that's what this number tells us. Another example I can give you of how this works is, I saw this LinkedIn video many, many years ago. And as a teacher, he's at the front of the class, he had this big glass jar. And he took a bunch of ping pong balls, dumped them into the jar, went to the class and said, "Class, is the jar full?" They're like, "Yes, the jar is full." Then he grabs a big jar of beads, puts it into the jar, fills all the empty spaces in between the ping pong balls, and goes, "Class, is the jar full?" They're like, "Yes, the jar is full." Reaches under the desk, grabs a bag of sand, dumps sand into the jar, fills all the empty spaces between the ping pong balls and the beads, and goes, "Class, is the jar full?" Nobody says anything because they were wrong the last 2 times, so no one want to be wrong for a third time. And then the funny part is he cuts away, he cracks a beer, he pours it into the jug, and the message of the story is always room for beer. That's not the message of this story. The message of this story is this density number tells us whether we're dealing with sand, whether we're dealing with ping pong balls, or whether we're dealing with beads. It helps us understand how much of this material can fit inside of a capsule. And then the last thing is, it always tells us maybe excipients, other ingredients that are coming along with this ingredient, because when we do declare non-medicinal ingredients here in Canada, we should always be declaring anything and everything that could come and that's not necessarily just added to the product, but comes as a function of the raw materials that we use. And we want to know this information because sometimes maybe there's an ingredient on there we don't like. We're like, nope, I don't like that ingredient. I don't want it ever in my product. It takes that ingredient out of the equation. So let's take this and put it into a practical example of how we'd formulate with something like this. So this would be a magnesium bisglycinate capsule. We can see that the density is about 0.8 grams per cc. Every cc is roughly the equivalent of a 000 capsule. That would be about this number here. So essentially what this says is we can fit 800 milligrams of this material in that capsule before it's completely full. So now we know our capsule weight in terms of the fullness. We know based on this that it's 10% elemental magnesium. So we take 800 milligrams, we times it by 10%. This would deliver 80 milligrams of elemental magnesium per capsule. So again, you don't like math, this is not going to be your job, but this is the formulatory process of what we go through with these sheets. This is another C of A for herbal ingredients. Maybe there's other things we're looking for here. This tells us things like the country of origin, tells us the botanical source, it tells us the part of the plant that was used, what type of solvent was used. Is it a crude extract? Is it a 4-to-1? Is it a 10-to-1? Is it a standardized extract? So we have to review these to make sure that it fits the criteria of the type of ingredients that we're looking for. All right, so that's sort of the basis of how we go through ingredients and sort of delineate between the type of ingredients. And then after that, we got to think about how we want to deliver this product. And again, I'm really just going to go through capsules and powdered scoop. What I mean by powdered scoop is like the products that are just like powder in a jar. You just grab a scoop and dump it into water or do whatever you want to do with them. At that point, those are really just the ones for the sake of example I'm going to go through. All right, so what we're actually going to do is an exercise. So this is, you guys can see the screen? Yes. All right, so this is a little kind of development formula worksheet that I work through. And essentially what I do is if I'm designing a capsule is I formulate this on a tab. I put my ingredients that I want to use in my product, I calculate my densities, and then I basically have this big mathematical formula that once I start filling in the numbers, it basically populates the entire spreadsheet for me. So over on the far right, there's like a red box that's got a 0 in it. That is going to tell us how much of a percent of a capsule is full. So we get to 100%, that means it's going to be 1 capsule. Get to 200, it's going to be 200. Get to 300, it's going to be 3 capsules. So you guys are going to help me design this. So what we're going to do is, there's no right or wrong answer to this as well. Everyone gets very shy at first. Is I'm going to ask you how much you want to put of the ingredients in the product. So we're going to see how many capsules this fills up. So the first is we're going to use 2 different types of mag sources. We're going to use a magnesium from a malate source. How much mag do you want from this source in your product? Again, no right or wrong answer. Just shout out any number.
200 milligrams.
So here, 100?
200.
200. Perfect. All right. 200. Cool. So we've already filled up 1 capsule, and now we're working on our second capsule already. We're at 111%. So now we're also going to use the magnesium bisglycinate material, buffer material. How much mag do you guys want from this source? 5 milligrams?
20.
I'll use 5 as the first number. By mag or calcium, this is where everybody starts getting cheap. It starts to go, wow, these capsules are really valuable in terms of the space, and the numbers just start dropping off from there. So this 5 milligrams only took us about 4% of a capsule. We're going to put some calcium. How much calcium do you guys want in this product? Again, no right or wrong answer.
20 milligrams.
20 milligrams, perfect. That only took about 7% of a capsule, so we're still on our second capsule. So at this point, this is where I start to think about the regulatory impact and what the monographs tell us on these ingredients in terms of what's the upper limit of what we're allowed to put of this ingredient inside of a product. So copper here in Canada, the upper limit is 5 milligrams is the max we can put in a product in a product that has copper. How much copper do you guys want in this product?
5.
5? Perfect. Boron, so upper limit here in Canada is 700 micrograms is the most we're allowed to put.
400.
400, all right. Zinc, most we can put here in Canada is 50 milligrams per product. 10, all right, sorry. All right, manganese, I think the upper limit is 5 milligrams is the most we can put of manganese in a product here in Canada. 2, all right. Molybdenum, I think 5 again is the upper limit.
2.
2, all right. Chromium, upper limit of chromium is 500 micrograms here in Canada.
300.
300. And very lastly is selenium, upper limit is 200 micrograms is the most we can put in Canada.
50.
50, perfect. All right. So this product we just made here is about 1.5 capsules. So this is going to be a 2 capsule product because we can't deliver half capsules. We have to use that whole next capsule. All right, we're going to slide to another example, which is now that we've got ingredients, we got to think about something called manufacturing overages. Because here in Canada, when you put a label claim on an ingredient, what you need to be able to verify with that label claim is that amount will stay in that product until the date of expiration. Not how much you put at the time of manufacturing, how much will remain in that product up until the 2-year, the 3-year shelf life of that product. And unfortunately, we deal with some materials, they're not stable in products. Some of that gets lost over time. So at the time of manufacturing, we need to add in more than what we state on label to ensure that we can meet that potency claim at the date of expiration. Health Canada holds us to that date of expiration. So for example, this is a product we did. We used the vegan D3 source. We had to use 30% overage and I have to budget this into the formulations. We used the K2 in this source. We had to use a 4% overage. So we do have to keep this in mind when we're thinking developmentally because we have to ensure that label claim to the date of expiration. So our product we made there was about 1.5 capsules. Now we also got to think, what do you do with another half capsule? Well, one of the most common practices is use something called MCC or brown rice flour. And this is the way we use it. We use them as bulking agents. They help us fill up capsules because if I put capsules in a bottle that were half full, every customer will come back to complain and say, you ripped me off. Where's the rest of my capsules? So we always have to bulk out capsules to make them full. Sometimes use MCC, sometimes use brown rice flour. This is a product where we were making an NAC product and we knew it had empty capsule space. So we said, nah, why don't we add some extra value to this capsule? Take some additive ingredients that are synergistic with the main ingredient, and we'll fill the capsule space with these other added ingredients. So it's just a different option that we choose to do when we know we have empty capsule space, is try to use that therapeutically versus just filling it with empty inert plant fibers.
Question.
You sure can.
Why do we would not make the capsule smaller?
You can. You can. So, I mean, 00 is sort of the standard size. You can find 0s, 1s, 2s. It's actually ironic. The bigger the number, it actually indicates the smaller of the capsules. The challenge is when you go from like a 00, let's just say, okay, I'm just use 1,000 milligrams. Let's just say it just for the sake of the example, because I pick a round number. A 00 can hold roughly 1,000 milligrams. A 0 capsule is about 500. There's nothing in between. So if you have a product that's 750, you can't use the 0, or you could. You just have to double the amount of capsules. Or you could use the 0 and then you have to fill the empty capsule space. It's not like a very small incremental that it goes down. There's still going to be a variability as we start to reduce capsule size. All right. So this is another thing to look at with material, something called material grading. This has nothing to do with quality. What we can do with materials sometimes is we can take them from ping pong balls and we can turn them into sand. Essentially, we were able to grind these things. And material density or grade basically defines whether we're dealing with a ping pong ball or we're dealing with sand. And we need to think about this as well when we're developing our capsule densities. All right, so that's sort of very rough, sort of how we do capsules. Powdered scoop goes through a very similar process. We got to think about our product, what ingredients do we want to use, what's the focus of this product. Then we need to think about our packaging, because if we're delivering a whole bunch of powder, we need to make sure that the serving size, the quantity, the amount of material is actually going to fit inside of the package that we're going to choose for this. Because if we go to the production line and I want this much material, yet I've chosen a bottle that's this big, production is going to be really pissed off because that's just going to spill over every single time. So we need to make sure we fit packaging to our ingredients when we're doing powdered scoops. We do verify this with the test density fill, and I'll show you some examples of that in a second. Fourth, we need to think about flavor. Unfortunately, when we're doing powders, there's an organoleptic. It's not something we can hide in a capsule. And sometimes we pick things that taste absolutely vile. They're gross. We want to flavor this stuff. You have to budget flavor into your formulation process, because that's going to take up some of the space inside of your jar. And the very last is a scoop. And this is more just something I like to say because it's a massive pet peeve of mine. You guys ever opened a powdered product and there's no scoop inside? And the label instruction just says 1 heaping tablespoon? That pisses me off every single time. Like, what's heaping? There's no like technical measurement of the word heaping. That's not like a definition of like an actual measurement. So we put scoops in every single product that are basically measured to be like the exact fill to the serving size, because I find it just unbelievably disrespectful when nobody puts a scoop inside of the product. Just a massive pet peeve. Massive pet peeve. All right, so this is a little experiment that I did. I took 6 different types of fibers. And again, density is everything, math is everything when it comes to product development. So we can make the assumption, we're like, cool, these are 6 fibers. They probably all have the exact same density because they're all fibers. Answer, absolutely not. Even though they're all fibers, they vary greatly in terms of their density. Top here, 198 grams of potato fiber. Below that, 402 grams of acacia gum fiber. Even below that, 500 grams of a tapioca. So again, we need to do our due diligence of verifying densities. We can never make assumptions. This is the same experiment doing free-form amino acids. You're like, oh, they're all amino acids. They're probably all the same. They're all different. Top here, I think this has light on this. That's tyrosine, 300 grams, 450 of lysine, 450 of glutamine, 450 of taurine, arginine, and glycine. So again, we can never make that assumption. We need to do our due diligence. All right, so that's sort of the idea of what we do with powders. Now, the third part of that is is the regulatory process with Health Canada. And when we're going to submit an NPN application here in Canada, there's really 3 classes or 3 streams of what we submit our applications into. Class 1 is you're going to make a product and you're going to follow one monograph and everything to an exact T. The dosage, the source, the health claims, the cautions, the warnings, whatever it happens to be, whatever that monograph says, you say, yep, I attest to everything within this monograph. It's a class 1 application. This takes us about 60 days to be able to get a product license approval here in Canada. A class 2 is where you take 2 different monographs and you sandwich them together in a product. So for example, if we want to do ashwagandha plus theanine, they have their own individual monographs. We want to combine those together in a product. That's going to be a class 2 application. You want to take zinc and echinacea, 2 different monographs, sandwich them together. That's going to be a class 2 application. And that takes roughly about 90 days to receive an approval here in Canada. Then we have this last thing called class 3. Class 3 is everything else. You want to use an ingredient that does not have a monograph. You want to use a dosage that's not covered by the monograph, a source of an ingredient that's not covered by the monograph. Essentially, you're following no monograph. To begin with, we have to put it in this thing called a class 3 application. And here in Canada, a class 3 application can take anywhere from 180 to 360 days to get approval from Health Canada. I personally have a class 3 application in with Health Canada. It's been there since 2021. It's 43 years. And I still don't have anything. So anytime we want to do something super cool here in Canada, because of our NPM process, it takes a very long time. So you also need to keep this in mind as well, because if you have an idea and you're like, this is like now, like this is hot, I got to get this thing to market. If it doesn't follow a class 1 or class 2, good luck. It's going to take you at least half a year to all the way to a year to do an NPN before you even think about putting that product into production. So again, the regulatory landscape is always something we have to keep in mind when we're going through our product development process. All right, so just a little bit more of the monographs. This is an old monograph. Vitamin C is now covered on the multivitamin mineral monograph, but this is what a monograph in essence looks like. So the monographs are publicly available. You can just type in NHPD monograph on Google, and you could get access to every single monograph that Health Canada has published. So the monograph basically tells us things like source materials. So you want to do a vitamin C monograph application. These are the sources you have to use. You can see on here things like acai or acerola are not covered here. So if you want to do vitamin C source one of those, class 3 application. They're not covered by the source information on the monographs. It tells us things like the use or purpose statements. These are the health claims that I want to make about my product. If you're like, you know what, I don't like those are garbage. I want a really cool health claim for my product. Automatic class 3 application because it's not covered by the monograph. It tells us dosing based on age population that we have to abide by. If you're like, you know what, adults, 2,000 milligrams, that's not high enough for my product. I want it to be 4,000 milligrams because I have something awesome. Automatic class 3 application, you are outside of the monograph. So we need to know these monographs ins and outs, or in and out when we're going through the product development process. This is also something I just put here from the perspective of if you look up anyone's NPN, which is public information, by the way, you can look up all my NPNs, you can look up any companies who has an NPN and an NHPD database. Essentially why I put this here is if you look at someone's NPN and this little statement pops up that says, as authorized in the NHPD, blah, 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 blah. Essentially what this means is it was a class 1 application. They would just attest it to the monograph. Health Canada doesn't even bother populating the information, like go look up the monograph if you want to know what their product attested to. On the other hand, if we do a class 2 application, we're mixing these monographs together. Health Canada does populate this information on everyone's NPNs. And same with the class 3, all this information is populated. This is an actual, if you go to the NHPD database on a liposomal GABA, which I think is a sample that you guys have over there. This is what it would look like in the NPN database if you looked up that product license for its NPN number. All right. Almost lastly here is non-medicinal. So, excuse me. All products have some sort of non-medicinals for the most part. Some ingredients don't, but for the most part, non-medicinals come as a function of ingredients that we utilize, or we add them into the manufacturing process for very specific purposes. And I know everyone wants their NMI. NMI is short for non-medicinal ingredient. Everyone wants that list to look as small as possible, but there's a lot of ingredients that we don't choose. We have to use in products for a number of different reasons. So I'm going to go through some common things that you'll find from a non-medicinal perspective in terms of why they're utilized in products and why you see them on product labels. So one, whenever you're making a liquid, citrus C, potassium sorbate, sodium benzoate's another one you'll see. We don't use that in any of our products. Whenever you're making a liquid product, you always have to design an antimicrobial preservative system in it. If it's a water-based liquid, always. When you do your little application for Health Canada for this, they make you a test to say you're going to do an antimicrobial challenge, essentially meaning you're putting in an antimicrobial preservative system into your product. Potassium sorbate, citrus C, this is what we personally use when we make water-based liquids. And we do this for your protection. Honestly, we really do this for your protection. The reason why is here's some very common ways that you guys consume your liquid-based NHPs. One, you're almost always in your kitchen. right? Correct? Yeah, cool. So you grab that bottle, you open it up, get ready to put it in a teaspoon. You take that cap and you put it right beside the kitchen counter, right on the kitchen sink. Your kitchen counter is one of the filthiest places in your entire home. Now you just put that cap on that counter and you're going to put it right back on the bottle after you've consumed the product. Number two, this is another way people consume liquids. Straight from the bottle. There's a bunch of bacteria in here. You've literally just put it into the bottle. Or number three, you're in the kitchen, you take off that cap, you go to reach for it. Oops, I accidentally knocked it over. Rolls a slow roll across the floor, underneath the dishwasher, underneath the stove, underneath the fridge. You pick it back up and you do one of two things. Not sanitizing, by the way. Two, you rip open the faucet and you rinse it with water. Not a sanitizing agent as well. You put it right back on the bottle. All three of those scenarios, you've just introduced bacteria into my beautiful product. I need to protect you from yourself, is essentially what I need to do when I design a liquid-based NHP. Vegetable glycerin, xanthan gum, acacia gum. These are commonly found in liquids. We also sometimes utilize these in powdered formulations. And essentially, they all serve sort of very simple purposes from a liquid perspective. We are doing the ultimate science experiment where we make a liquid-based NHP. We are taking water and we are taking a bunch of solutes or powders and we are dumping it inside of that liquid. And guess what happens if you just took powder, dumped it in water, put it there for a few months? What do you think that powder would do? Over the bottom would settle in the bottle. And then you'd be pissed at me because you're like, dude, why did this stuff all just settle on the bottom of the product? It doesn't blend well. Well, in those cases, we need to create suspensions. We need to use things like vegetable glycerin, xanthan gum, acacia gum, to be able to suspend particles so it creates uniformity of dose every single time that you happen to take the product. So when we're doing this, we do need to sometimes add suspension agents depending on the weight of the material we're putting inside of the product. Caramel color is used a lot in soft gels, also used in liquids. We don't personally use this in, I think we only use it in one soft gel based product, but it's used a lot in liquids as a way of color uniformity. And it's actually used a lot in the alcohol industry, whiskeys, brandies, scotches use this. And the main reason why they do is when we're making natural health products, a lot of times using natural agents. And there's color variability that happens within batch to batches. Like if you took 25 rhizomes of turmeric and cut them all open, they wouldn't all have the exact same color. There'd be a little bit of variability between each of the rhizomes. We make a product and basically put these ingredients inside of it. There's variability that can happen within the product from batch to batch. And then what happens is the customer buys one bottle, they go back, buy a second bottle, they open it up and like, it's a little less yellow than it was the last time. And you're like, it's the same product. It's just got some natural color variability. So what some companies do is they'll add caramel color. So this way it creates the same color every single time. We don't do this. We just let it be what it is. We'll have some natural color variability because we use natural ingredients inside of our products. Sweeteners, if we're making a liquid, we're making a gummy, we're making a chewable tablet, anything that has an organoleptic profile to it or something we have to taste, sometimes we have to use sweetening agents for these products. Again, because some stuff just sucks. Like some stuff is literally just vile. And everyone always tells me, you know what, oh, can you just make it unflavored? I'm like, you wouldn't take it. Oh, but I'd love it if it was unflavored. It's like, you wouldn't take it. It's disgusting. Like we need to put some flavor in some of these things because if you tasted it, you'd be like, that's the worst thing I've ever had in my entire life. So we have to make our sort of best guess in terms of when to use flavor and use sweetening agent to help with compliance, to help people ensure they like the product and they will consume it over and over again. So some common things we use are things like alcohol sugars, like xylitol, sorbitol. We don't use sorbitol in any of our products. Monk fruit is another one that's become quite popular. Allulose is another one that's become quite popular. Stevia is one that's become quite popular. There's another one off the top of my head that I can't remember that sort of fits into there. But again, we use these as a way of just sort of flavoring stuff that have a taste profile to the products. All right, citric malic ascorbic acid. We use these in liquids. Sometimes we use these with capsule-based products. And essentially what these are buffering agents. They help us adjust pH of products and ingredients. And I'll give you a good example in terms of a liquid-based product where we have to use citric and malic acid to create an ideal pH. We have a magnesium product, magnesium bisglycinate liquid product. And if you took just that magnesium bisglycinate, put it in the water, the pH of that solution would be roughly about 10.5. That is more alkaline than baking soda. Has anyone taken baking soda on an empty stomach? Don't try it. You're not going to feel good. It does not feel good. This product would have a greater alkaline pH then baking soda, it would make you feel any worse. So we have to use things that adjust pH to get things more into an ideal pH that aren't going to create stomach upset. So by adding citric and malic acid into this product, we actually reduce the pH to about 7, which is essentially the pH of water. It's neutral. It's not going to have the same digestively irritating effects that if we left it be its natural pH. Mag stearate. All right. So this one's used quite commonly in capsules. I am going to sort of just take a survey here for a second. Hands up for those who feel negatively about mag stearate. One at the back. Anybody else? All right. So it's fair. I can understand there's been a lot of talk about magnesium stearate. Why we use magnesium stearate in products, it's a flow enhancer and it's a lubricant for essentially the manufacturing machines. Because we're dealing with big metal machines and we have powder that are flowing down these machines. We need things that are going to lubricate and push the material down, or it's just going to bung out the machines and get all very, very sticky. Think about it also kind of like motor oil for your car engine. If you put no motor oil in your car engine, those pistons would pump, 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 and then eventually they would break because they need something to lubricate the pistons to be able to have the mechanical action. We need the exact same thing to happen during the manufacturing process where we're having powder and we're packing that stuff into capsules. There's other alternatives that some people use. There's like a brown rice flour that is used sometimes. I'll be honest, we've tried it so many times, it sucks. It doesn't work very well. And we do rely on magnesium stearate for this purpose. When you look at what magnesium stearate is at its root, it's two things. One, it's stearic acid, and two, it's magnesium. So let's just break this down. Magnesium, good or bad? Good thing. We all think magnesium is good. Okay, sweet. Magnesium essentially is bound to stearate. What happens with magnesium stearate is when you orally ingest it in stomach acid, the bond that exists between magnesium and stearate breaks, and stearate turns into something called salt that turns into something called stearic acid. Does anyone know the highest dietary intake and source of where we get stearic acid from? It's on the slide. Spoiling. Oh no, I'm actually not spoiling it. Never mind. Fruits and vegetables. Fruits and vegetables roughly can we consume about 6 to 8 grams of stearic acid per day just by eating fruits and or vegetables. Fruits or vegetables, good or bad? Good for us for the most part. So really break down what magnesium stearate. It's something that we get from fruits and vegetables in significantly higher quantities than whatever we could deliver in a capsule, and magnesium. With every capsule of our products, we roughly add about maybe 5-7 milligrams of magnesium stearate, when the average individual through fruits and vegetables gets about 6 to 8 grams of stearic acid per day. So I'm not trying to say you should like it or that. I'm just trying to sort of shed some light in terms of our perspective, at least my perspective, in terms of why we utilize it and the safety profile of it. All right, microcrystalline cellulose or MCC. I sort of talked about this with the capsule fill. Again, it's an inert plant fiber. It's usually derived from birchwood pulp. And again, we really just use this to bulk capsules so that we can create bulky capsules and we're not delivering half-empty capsules. We also use it as a flow agent along when it's used in combination with magnesium stearate. Maltodextrin. So this one has a little bit of sort of controversy. Not controversy per se, but let's just say it's sort of on people's no-no list. I'm going to tell you this. I'm going to be very blunt and honest here. A lot of products you guys consume have maltodextrin. They just don't list it on label. Maltodextrin is used basically from an ingredient perspective for two purposes. One, when we create natural flavors and natural colors in powder form, this is how we make them. We extract like pigment or flavor from like a blueberry or a raspberry. We create this big, mucky, liquidy mixture, and it's like a big liquid sludge. We can't put that in a capsule. You can't put sludge in a capsule. You essentially need to powderize it. What you need to do to create powder is you take that and you spray dry it to a starchy medium. Maltodextrin in 99% of cases is what that sludge is spray dried to, and then we powderize it. So when we use natural colors or natural flavors in powder form, there's always a starchy medium that thing is spray dried to, whether it's maltodextrin. Sometimes it's acacia gum is used in this fashion, but for the most common, it's maltodextrin. So if you use natural flavors and natural colors, chances are there is a little bit of maltodextrin inside of it. Second is herbal extracts. So when we create like a standardized herbal extract, we do the same thing. We take an herb, we pulverize it. If we're extracting in things like ethanol and water, we're running it through a process where we get this liquid at the end of it. And essentially we need to spray dry it to something in order to create a powder that we can crystallize and then put inside of a product. So we don't add maltodextrin to any products, or companies don't typically add maltodextrin to any products. It comes as a function being an excipient of some of the ingredients that we do choose to utilize in our products, whether herbal extracts or natural flavors and natural colors.
Question.
Yes.
that more favorable than gum, or is it the same?
Maltodextrin versus like acacia gum?
Yeah.
To be honest, most companies in terms of flavor companies or herbal extract companies, they just choose to use maltodextrin. There are some companies now, we've been working with one company who's now sort of pivoting to tapioca starch as sort of a spray dry medium, but I'll say the most popular agent that sort of is industry used is maltodextrin. I'll be honest, I'm not 100% why. Maybe it was just the first one that everyone sort of started utilizing and getting out of that practice just became, a challenge for people. Yes.
I imagine that just speculating on what she was talking about, that acacia gum and tapioca starch would be preferable simply because they're also prebiotics, which your body needs to properly utilize a lot of the vitamins, supplements that you can take.
Yeah, I'm not arguing those are preferable.
I'm just suggesting like that might be why it could be preferable.
Could be a cost factor. Maybe maltodextrin is significantly cheaper than acacia gum and tapioca starches as well too. All right. Oops, I did that slide already. All right. So lastly is the finished product testing here. So here in Canada, when you bring an NHP to the market, there is a set of finished product testing that you are required to have to do on every batch and every lot of every single product that you produce. And I say this sort of jokingly, but there's a little bit of truth in every single joke that they happen to say. I know companies come along and they're like, oh, we do product testing, and they expect you to sit there and clap for them. No, like you are required to have to do these things. Like doing testing is not something you should be applauded for. It is just part of what you have to do to be able to be an NHP company here in Canada. You are required to have to do these testing on every single product, every single batch, every single lot that you happen to do. And again, the testing varies based on ingredients and different formats that we choose to put products in. So some of the things that are required for every batch that we do, one is an assay test. So if I put magnesium in a product, I have to assay for magnesium. If I say it's 300 milligrams, I got to make sure that I've got 300 milligrams with my finished product testing. If I put zinc, if I put vitamin B5, vitamin D3, whatever it happens to be, you have to assay to ensure that that potency is at what you said it was going to be. We also always have to test heavy metals on every single product. Every single product. You always have to test heavy metals. You also have to test yeast and mold on every single product. Doesn't matter the product type, liquids, chewables, gummies, capsules, soft gels, whatever it is, you always have to test yeast and mold. You also have to basically do a microbiology panel on it as well. So you're testing flow plate or overall bacteria counts, measuring CFUs. You have to test for E. coli. You have to test for Salmonella. You have to test for Staphylococcus. And when you make a water-based liquid NHP, you always have to also test for something called Pseudomonas aeruginosa as well too. So if you design a liquid, you got to keep in mind that now there's an extra micro test that we have to do as well. And then there's a whole bunch of other stuff we have to do, like weight variation, disintegration, rupture tests. Essentially what those means is if I deliver a capsule, can I prove that that capsule is going to break apart within less than 45 minutes, or essentially the amount of time it's going to stay in the stomach and start reaching the small intestine so the capsule is able to break open delivered contents? Yes.
Have you heard of companies that are like either bypassing or lying these tests? Because I have heard of, I won't say the company, but a certain smoothie powder company, their protein powder that was tested with heavy nuts inside.
Let's just say Health Canada does not audit every single batch of every lot that you happen to produce. They don't ask you at the end of the year to say, give us all of your records. There's kind of a little bit of an honor system that you may get audited, and then they'll come in looking for certain pieces of information. You don't have to give them everything because they won't ask for everything. So I could see worlds where
And would that be for self-testing or for third-party testing, or like it's third-party more reliable?
It's a good question. So, and I'll be very truthful and honest here. We do third-party testing. We don't own a lab. Essentially what third-party testing means is you don't have a lab that you are personally testing the product at. You're using a third party, someone who's at arm's length. There honestly is no problem with using a non-third party if your lab is accredited. So when you develop a lab here that you want to do testing at, Health Canada grants you a site license saying you're approved, like you follow all the proper standing operating procedures, you have all the proper policies in place. And if companies happen to have that on site, good for them to have the ability to be able to do that as long as they're following the proper practices. So We don't happen to have a lab, for us, like, it's just not something we're necessarily interested. So we just primarily use, third parties as a way of verifying ours. The thing with in-house testing as well, and I'm not saying this happens, but I'm just trying to think of all scenarios. There are worlds where if you control that entire process and, you're beholden to that, you could have control over the results, what gets released, what gets ignored, what doesn't get ignored, because you're not necessarily at arm's length. Our third-party labs, they don't care if something fails. Their job is just to get paid to run a micro pen. If it passes, great. If it fails, they don't care. They're just like, here's your report, your product failed. So, maybe I guess you could say there is a little bit of more impartiality with using third-party labs from that respects. Yes.
Is this only for oral products, like products taken orally, or can it be like topical, like a magnesium oil?
So topicals, we do have to do things like heavy metals, micro, if they have like a marker, like let's just say it's mag, you should be doing a potency because you're making a label claim of something. And then there's other tests that maybe we have to do with like topicals, things like viscosity. It's basically like measuring the sort of the density of cream. It has a different set of testing. This is also specific if you go the NHP route, because when you go natural health product route, there's a very independent of delivery system. There's a very specific set of testing requirement that we have to do. With topicals, not the challenge, but people could go cosmetic route. And with cosmetics, there's no NPNs. You don't apply for anything. With a cosmetic, literally all you do is you send Health Canada an email saying, we're bringing this product to market. That's it. That's your regulatory process. So in terms of what required tests cosmetics may or may not have versus NHPs, I'll be honest, I'm not 100% sure because we don't dabble in any cosmetics. Yes.
Why is it so much easier to make products in the US? Is it the NPN process that's shorter, or is it the testing?
Good question. So the US has no NPNs. Their process is kind of similar to how we do cosmetics and food here in Canada, because in the US, supplements are under food regulation. They're the same as food. FDA basically says they're food items. Here in Canada, we have separate legislation that separates food from supplements. Very different regulatory processes, different practices that you have to abide by. So in the US, all you have to do to be able to bring our product to market is you basically submit like a document to the FDA, and then within a month, they just go approved. They don't give you a number. They don't evaluate anything on it. They basically just receive your application, give it a good old stamp, and then you can bring it into the marketplace. They also don't really have the same regulations from the perspective of there's like GMP testing practices they ask you to follow, but it's not necessarily outlined in the same way that we have it here in Canada. It's why you see a lot of those reports, they come out like 5 out of 10 companies failed CoQ10 testing. And it's all US. It's all US companies that they do this with because it doesn't have the same required testing that we have to do here in Canada. It's very much the wild, wild west down there. No regulation like we have. Yes.
What associates the products from like real mushrooms? With the testing happening here,
Good question. So there are some tests that we can use raw material data to validate the product. So we get like a C of A per lot from a manufacturer, and we can utilize that from an assay perspective. I'll give you a good example. So if you're taking a single ingredient product and throwing it into a bottle, nothing else, you could use that C of A from that supplier because they've tested it. And as long as you put the right amount of material in, it should meet your label claim. So thank you. So that is something you can do. Health Canada does allow companies to use raw material testing in lieu of finished product testing in certain specific practices. But the gold standard in terms of what should be done is if you are bringing products from elsewhere, it should always be tested post being in a finished good form. So you import a raw material, put it in a capsule, put it in the bottle. That's when you should be doing your finished product testing. Is that at that point? I don't know if that answers your question. Does that answer your question? Yes.
Have you ever heard of NHP products being tested for organic or because that's an USDA standard or an FDA standard in the US? For some, like people that decide to get their products certified that way?
I'll be honest, I'm not 100% sure where that is specifically categorized in. There is some, it might be, so when you
Like
use,
pesticides, PCBs, all that are included in the organic.
yes, so, okay. So it's on the slide here as well. Whenever you use a marine sourced ingredient, you always have to test for dioxins, PCBs, etc. It's a requirement from Health Canada, always have to test for that. Anytime you use a naturally non-synthetic ingredient, so you use like an herbal extract, you want to use rhodiola, you want to use ashwagandha, you want to use trying to like quercetin sourced from Sephora japonica. Anytime you use a natural origin ingredient, you are always required to have to test for pesticides. You always have to test for pesticides here. There's also another thing called residual solvents, which I think is what the ingredient you referred to falls into. So if you use a product, an ingredient in your product, that a solvent is used in that process that is not, other than water. If you use water, you don't have to do something called residual solvent testing. If you do like ethanol as a solvent, you use ethyl acetate, you use
Hexane,
hexane.
as in for extracting tofu.
Yes, you are required to have to test residual solvents. You don't have to test necessarily the finished product, but you have to, at bare minimum, make sure the raw material that uses that solvent is tested or the finished product is tested. It is residual solvents is a mandatory test based on use a solvent other than water. Any other questions? These are all good questions. Yes.
I'm curious, have you worked in this field before the NHP?
So I started working in this field in 2006. This was before NPNs came into place. We were in a place called Uplar, pre-Uplar, which is where they were in the process of developing the NPN system. And maybe people do remember this. I know Norman probably remembers these days. We are transitioning to something called ENs. And ENs was something called an exemption number. An exemption number was simply this transition between no NPNs to NPNs. You basically had to apply to Health Canada for an NPN, and then you were granted this EN number that said you were in the process of trying to obtain an NPN number. Who knows when you would have got it 3 years from then, 2 years from there, 4 years from then. But there was this transition phase before there was no NPNs, and I wasn't in this space for a long period before we were sort of in the regulatory landscape, or at least moving towards a regulatory landscape right now. It's okay. So I'll sort of, maybe this is a fair thing to say, is like, I'm not bashing the regulatory system we have. Like, that's not what I'm saying. I think a level of regulation is good for the industry. Otherwise, you're going to get a lot of the things that we're talking about here today, where like, this heavy metals is failing and this isn't, and you could get dirt in a capsule and nobody's knowing whether you're getting dirt in a capsule. So I think there's a level of regulation that is required for consumer protection and quality, because if you pay money for something, you should get what you pay for. In terms of the system, in terms of where it's at now, you guys have probably heard of cost recovery, the whole cost recovery thing. No, you guys haven't? Maybe I'll finish this and I'll talk a little bit. There's some stuff of where it's going, where it's just creating a lot of challenges to make Canada an innovative marketplace from a natural health product place. I still feel like people should have access to new and cool stuff, but sometimes our regulatory framework can be restricting in terms of allowing that to happen. I'll give you a great example of that. So we have liposomals. You guys know we've got like 9 or 10 liposomal products. I have had more liposomal applications rejected than I've had approved, because I've tried so many things. But because the requirements of what Health Canada wants to grant me product license for certain things in liposomal form, the data doesn't necessarily exist in the fashion that they wanted to exist, they shoot me down. And then it makes it a challenge for me to say, bring some really cool things to the marketplace, because it doesn't fit into, at times, their restrictive box of what they want. Yeah.
If they do exist, and I'm pretty ignorant about this because I've been on it for a while, if there are clinical trials like standardized trials, looking at standardized dosages of different natural health products.
Yep.
Where's the best place to look for them to kind of back up what you're recommending to your clients?
It's a good question. I mean, there's multiple different sources. I'd say the most generic one is PubMed.
I go there all the time, but
It's probably hard to find exactly.
I
what
haven't been looking at clinical trials, but I've been looking at just like ingredients because I practice Ayurvedic medicine.
Yep.
And there's heaps of studies, but no standardized clinical trials on most of those ingredients because there's no money like nobody wants to fund that. Nobody's going to make billions of dollars from a natural health product versus a pharmaceutical drug.
Yeah.
Right.
There's.
So I was curious. I'm used to this. I've been doing this for 20 years. So I'm used to the idea that that's not there to back me up, and I have to be very clear in my communication with my clients. But if there is what's the best way to look for them, and where would you?
So it's a tough question to give you a great answer. I mean, PubMed is a database that all clinical trials that are validated and published in peer-reviewed journals go to. You'll find.
So would you look under
millions.
clinical trial and then put in your ingredient or your product?
You're going to get way more than you want. Like, to give you an example, if you type ashwagandha into PubMed, you're going to get like 50,000 hits. And there are filters you can use within PubMed to filter the information to a little bit more of your specifics. Like, I only want human, because it'll give you in vitro data, it'll give you animal data that's been published. You can make it a little bit more specific and saying like, I want a randomized clinical trial versus like an open label trial or an observational type of trial. It can get you a little bit more, sort of specific. Google Scholar is another platform that has it as well. But I'd say like for something where you're trying to get the most amount of information, that's probably, you just have to filter it to the needs of what you want.
That helps.
Yes.
But I want to create products that don't have enough money. Sell them if they're a huge line. Like if I were to create a product, mix it all together with all the science, knowledge, and then one sell it or have it in practice or put things together into a team, for example.
In Canada, selling in Canada.
Yeah.
It kind of depends what you want to do with that. So you can go the food route. When you go food route, like you could put, a lot of companies do this, like you could put magnesium and something and you can make a food item out of it. The difference is when you go food, you can say nothing about your product. You get 0 health claims. Like you can just say source of mag. You can't take any of the health claims that are published from Health Canada. You say any of that, you're going to get in big trouble because that is only reserved for products that go through the NPN process. So a lot of companies right now are actually going food because they don't have to do any NPNs. It just severely limits, what they can say about their product, but maybe that's okay for them. They don't want to have to go through the hoops of the NHP system. There is something called a pharmacist can do it. Certain things can do it. There's like it's kind of like a loophole, I guess you could say, where you can do kind of like personalized compounding, we'll call it. But again, I just wouldn't make something and go like, L-theanine, the health claim it says is helps the temporary permanent relaxation. If you put L-theanine, I just wouldn't say that anywhere on your stuff because that's health.
Say a verbal.
Yeah,
you just have a little food truck or something, have a little supplements inside. Their name is just hypothetically.
Yeah, no, I know what you're saying.
I could have like the ingredients. I just can't have the benefits. Like
you can't say anything.
This tea will help you sleep. I'll just say this tea has such and such.
Yeah, you just
said it does nothing. You're like, this product does absolutely nothing.
Chamomile in a bag. That's it. It's like, I got chamomile in a bag. That's it. Who wants chamomile in a bag? On the packaging. Yeah.
Okay, so this is everyone here witness legal information.
No, this is not advice. I forgot to put a disclaimer on here. Follow your regulations. Follow your proper practices. All right. So much is very last again. Some of the specialized tests, I think I talked about a little of these things. If you do a mushroom-based product, here in Canada as an NHP, you always have to test for mycotoxin as a function of this. Yes.
So just make sure. So
all the products in the US that are approved in the US, and they want to sell them in Canada, they also have to do those tests?
Yes.
So there's a little bit of a loophole with this. So if they want to sell their product that's a US product, like through like a retailer, like they want to go to Choices, perfect, Choices, fellow Choices, they would have to have an NPN number. You cannot sell in that model with an NHP without it being having a NPN. There's something called the personal exemption. What this means is, and you guys probably get this from Instagram, Facebook all the time, is you get these US supplement companies advertising to you. It's like, buy from us, and you get this buy 25, and you get, or subscribe to this subscription model. So here's the Canadian, you are allowed to personally bring in US products to use for personal consumption that don't have to be NPN approved, because you're not reselling it, you're not recommending it, you're not using it in a business practice, you're just using this for personal use. You also are only limited in terms of the amount of product you can bring in. Like I don't know the exact number. Let's just say you can bring in 3 bottles of it at a time. It falls under your personal exemption. As soon as you bring above a certain amount, it's going to get flagged at the border because they're going to say you're bringing in commercial volumes that you are then going to resell. So you can buy US unregulated Canadian supplements. You have something called a personal exemption to do that.
Okay. So everything in the store is tested?
Should be. It has an NPN. That should be. Yes.
Oh, no, I was just gonna say, I think it's a 3-month personal supply. That's what I've been experiencing.
So, yeah, I don't know. That might be it. I'll be honest, I don't know the personal.
And for example, Pure CO2, which is, I think, an amazing supplement company. Their ingredients are amazing. They've been waiting for 5 years to get their NHP. And it's so they have to go through the same hoops, and they're regulated. Their procedure is different. So I think they've been having problems getting all the studies for the lab data together without presented properly to the government.
It's different. Like the way that the FDA, if you do testing, the FDA's testing methods, limits, ranges are different than what Health Canada asks for as well too.
You're talking about mushrooms?
No, sorry, just like US testing versus Canadian testing. Yeah. Mycotoxin. Yep, in all mushroom-based products. And the very last thing is aftermarket tests. So these are things that we have to do after we manufacture a product. Disintegration, dissolution, don't worry about those. Microbiological challenges. So we have to do this when we make a product that I talked about to have the antimicrobial preservatives. You have to do a test to prove that it's not going to create bacterial growth. So what you do with this test actually is you take a bunch of bacteria, you throw it into the product, and you observe it over 6 weeks. And you look at the microbial content over time, and it shouldn't rapidly divide because your system should be able to keep bacterial growth in check. We have to do stability studies. Essentially what I mean by this is you say you have a label claim of a product, you have to do studies, shelf life studies to prove that if I put 3 years on my product and I see there's 100 milligrams of zinc, I can prove that I've done a study over 3 years that I can meet that label claim. You have to prove that. You don't just go, yeah, put 100 milligrams, lab test says. You have to do tests to prove your shelf life to Health Canada as well. All right, I think that is it.
So I'm sorry, to prove your shelf life, which you have had to do that 3 years prior to.
You don't, here in Canada, you don't necessarily have to do a pre-market shelf life validation. You can do certain tests if you want where you're concerned, something called an accelerated stability study, where you basically put your product in accelerated conditions that when you do a study for 6 months, it mimics the real time of 2 years. So you more do those with products where we're just not 100% sure if this thing is going to do what it's supposed to do. We think we're concerned about it meeting its shelf life. On the other hand, with something like magnesium, never do something pre-market. Once you put mag in a product, it's there till the next ice age. You cannot create or destroy magnesium. It goes in the capsule. It stays in that absolute capsule. So when we do products like that, we already sort of have an idea that it's going to meet shelf life. So you can or you cannot. Really, what Health Canada is more concerned about is once you set a shelf life for your product, that you do studies after market to prove that you meet that shelf life.
So you could get away with selling something for 2 years.
You could, yeah. I'm like trying to give you all the ways to like break the rules over here. Sorry, question?
My first question, what research and evaluation processes does your company employ to identify the nutritional and medical benefits of local foods and plants, especially from other continents, for incorporation into supplement formulation when we don't have enough information available in hand? And concern the product we are using for.
Sorry, we'd be talking about like different countries of origins that we source from. So in all fairness, we source from all over the world, like all over the world. Companies will say this, they don't source from certain places. In some cases, certain places hold the monopoly on ingredients. So I'll give you an example, vitamin C. It all comes from China. Just gonna be blunt, China owns the monopoly on ascorbic acid, owns it. Maybe people buy it from a guy in the US and they go, I got it from a US guy, but he bought that from China and he's a distributor for that. So there are certain ingredients where, there's sort of a monopoly in terms of where you source from. And, in all fairness, like we source from all over the world. Our K2 comes from Norway, our collagens come from Germany. It's also a little bit from Brazil, also a little bit from Iowa. We do have some stuff that comes from China. We've got some stuff that comes from Japan. Our acacia gum comes from the acacia gum belt in Central Africa. So we do source from all over the world.
Thank you. My second question, are there any particular challenges or considerations to be mindful of when integrating local ingredients from other countries into supplement formulation in terms of sustainability?
It's a good question. Yes and no is my best answer. We do have ingredients that we do utilize that have a sustainable track record to it. Some we don't because they're just sort of generic or they're synthetically derived. Like a lot of things we use from a vitamin perspective there's not necessarily a sustainable concern from them from a natural ecological perspective because we do synthetically derive them. So I would say it's something we're conscious of, but it doesn't necessarily is the only motivating factor in terms of our ingredient selection.
My last question, thank you. Do you have any specific strategic partnerships with local stakeholders like farmers, research organizations, or ingredient suppliers to support sustainability and ethical development of your products?
We do take into account companies who do have an ethical, mantra to them. For example, we use a source of ingredient from South Africa. It's called Scolidium torsionum. It's a branded ingredient named Zebrin, who works with the local farmers. They put profitability back into it. All of our ashwagandha is a KSM 66, and they're ones who work with sustainable farming practices in India. They basically own the farms themselves. They treat everyone very, very well. So it does go into our practice, I guess you could say. Not necessarily every ingredient follows that, but we do have ingredients that do sort of fit that portfolio. And in terms of like the research side, we don't support research directly. I think it's a little bit of conflict of interest. But for example, we've got a clinical trial right now going on with the Cleveland Hospital on our D3K2 and long COVID. We're in the process of potentially setting up a clinical trial with the University of Alberta Health Network with one of our infant probiotic formulations. So we have a few things we sort of are trying to work within from a research perspective. Any last questions? Any last questions? In the next room, there is a whole bunch of supplements. You guys need to get a chance to pick a water bottle. So not a water bottle. It's a shaker cup. There's a table of collagen in front of you. There's 3 options. I think you guys get to choose one of those 3 options. There's a middle table that has a product called Omega Twist. Each of you gets one of those. Besides that, there's 3 liposomals. I think you guys get to choose one of those liposomals. And then just beside that, there's 3 other products, and you each get one of those products as a thank you.
And should be in the room.
Okay, I'll help it out. All right, yeah.
Thanks, John.